Pip, come on, Pip. What you got? Is there any reason you wouldn't do a mummy makeover, please? So, for example, would a patient having a secondary augmentation with uplift along with tummy tuck cause a patient to be a higher risk? So is there a time limitation on surgery, please? Thanks. No, Pip. There is no real sort of time limit on surgery. There's no time limit on surgery, Pip. How do I do start a live video on Instagram? You can share a live video to collect your followers. Tap the photograph in the top left feed or swipe right from anywhere in the feed. Swipe right. Oh. Back in the room. There you go. So back in the Instagram live, part 2. Question from Pip here. Hi, Cindy. Pip says, is there any reason you wouldn't do a mummy makeover, please? So, for example, a patient having a secondary augmentation with lift, along with a tummy tuck, cause a patient to be a higher risk. Is there a time limit on surgery? Not really. A lot of people ask about time limits on surgery. I mean, obviously, shorter the better in terms of surgery. You don't want to have long surgery if you can avoid it, and the less time you're under anaesthetic, the better. And a mummy makeover is quite a big operation. Now, a mummy makeover can cover a spectrum of procedures. So you can have a mini tummy tuck, you can have a full tummy tuck, you can have a 360-degree lift. So you can have, tummy tuck surgery, which is small, and a tummy tuck surgery, which is big. And similarly with breast, you can have a breast augmentation, which is, not that big, whereas you can have a breast uplift and arm implants, which is what you're talking about, or a breast reduction, which can be a much bigger operation. So, if you combine two of the bigger operations, then you're getting into big surgery. But certainly, done cases where you've done 360-degree lift and breast reduction or breast lift with implants, which is sort of top end of the time, of the length of time. But you can do surgery for a long period of time if needed. So the thing is, Pip, it's a discussion with you, the patient. It's not an absolute contraindication. So it's not an absolute no, we're not going to do that. It's because it's unsafe. It's a discussion with you, the patient, to say, look, this is going to be a big op. It's going to knock you back massively. It's quite a long anaesthetic. You might want to consider staging it and just having a tummy tuck and having your augmentation with lift at a different time. Now, you might say, well, that really doesn't suit me. I want one recovery. I understand it's a big deal and there's risks and what have you. I'm happy to take that on, in which case we'll go, okay, well, then that's fine. Or you might say, you put for a video tomorrow. There you go, Terry. I'll see you tomorrow. So yeah, you might. So that's so there's no absolute contraindication to having a mummy makeover, but the bigger the surgery of each of the tummy and breast thing you're having done, it is going to make the surgery longer. So you might want to consider having it staged. Perfectly reasonable to stage it. Having my FDL tummy tuck, fleur-de-lis, people, that is okay, which is sort of inverted T. A year ago, you've changed my life. Look at that. Wow. That's what we want, Cindy. I'm glad you're here. I'm glad I came back to Instagram. Look at that. I wish I could heart that. Can I heart that? If I start touching it, I'm going to end up blocking you. So thank you, Cindy. That's good to hear. I think they do. I said a life change. A tummy tuck is a life changer, especially a fleur-de-lis. It's quite a big one. Well done, Cindy. Thank you. Kind words.